So in my new spiel, I'm one of the specialist pharmacists here.
Yeah.
So in the absence of Dr. Abraham, I'll do the clinic today because we want to cancel it because then all the slots are filled.
Yeah, because it's been about 4 weeks since I had my blood work done, so...
Demand is high.
Yeah.
And we don't have more doctors, so we didn't want to cancel this one because...
I think it was my fault. I think I had to cancel one of the appointments because they only give you like two days notice. You get a text message telling you to be in like 2 days, and it's
fine. It's fine as
so
long as we
difficult.
can accommodate you, and as long as obviously the main thing is you're not going to run out of medications in between. That's the main things. But I can see, as you say, you had your bloods done on the 23rd.
Yeah, I've got about a month and a bit left medication. So
please.
Yeah, 5th of the 879.
Thank you so much. So we did your blood on the 23rd, 10th, 25. So the key ones are viral load was undetectable.
Awesome.
So that tells me, number one, our tablets are doing what they're meant to be doing. And number two, you're taking them, which is...
Yeah, I mean, I've only ever missed a dose twice in 4 years. I have double dosed once as well, so I've put in precautions now to ensure that doesn't happen anymore. So I've got an alarm on my phone, I've got a pill box, and I also mark on the calendar that I've taken the pill that day. So I've got three.
It's totally understandable. This is a lifelong commitment.
Yeah.
It's, you know, and these things do happen. You know, the drugs aren't going to suddenly disappear from your body if you miss 1 day because of their half-lives.
Yeah.
Means they're still effective. It's only really when we get into realms of weeks.
Yeah, so one thing I wanted to ask actually is I get asked quite often. In fact, I did a talk yesterday about this and I wasn't too sure on what to say. You know, obviously missing one pill here, one pill there is no big deal. How many pills would you have to miss to become detectable? And I know it's probably difficult to say.
It's very difficult to say. So
it's something I get asked a lot.
National guidance. I completely understand what you're saying. Missing one pill won't do anything. The national guidance says don't miss any pills, and that's the message that we portray. And most of the literature and advice is don't miss any doses. When it comes to theoretically, how long could you get away with? It's all dependent on the half-life of the drug that you're taking. So obviously we have a number of different regimes.
Yeah.
Some of them have longer half-lives than others. All drugs are metabolized by enzymes in the liver. So then it means how much of that enzyme do you produce? Everybody's completely different.
Yeah.
Some people produce more of the enzyme, which means that the half-life in theory, say for example, literature states it's 15 hours. Half-lives are difficult to explain. So half-life is you take a drug and it gets absorbed, and then the levels of that drug go up in your body, and then they reach therapeutic levels, which is what pharma companies work off. When you're above a therapeutic level, then the drug's doing what it needs to do. After a certain amount of hours, say 12 hours, the concentration drops by half. Now, even if it dropped by half, depending what the initial level was, even if it dropped by half, it could still be above therapeutic levels.
Yeah.
Whereas some drugs, if they drop by half, could go below therapeutic levels. So the regime is, the drug that you're taking is the first factor. How much of the enzyme you're producing is the second factor. And if you are on any other medications, they can potentially increase the amount of these liver enzymes. So that would then further reduce the drug levels in your body over a certain period of time.
Yeah.
And some of them inhibit those enzymes, so they can then keep the levels higher than somebody who wasn't taking that drug.
Yeah.
So those, and then lifestyle, to a point, there's some data to state that individuals who smoke, smoking can induce some of those liver enzymes.
I actually quit smoking the day I was diagnosed. So I've 4 years, no smoking, no drugs. I had addiction issues for 26 years, so I've been sober, clean and sober for 4 years. Gym every day, eat as healthily as I can. Don't get me wrong, I do like a bit of junk food here and there.
So things like that will also, help not increase those levels of enzymes. So the drugs, in theory, these are all theories and lab studies and stuff. will increase the amount of drug in your body for longer periods of time.
It's something I'll try and get out there as well, that living with HIV doesn't mean you can't be fit, strong and healthy. And
No.
in fact, I'm more active now than before. Before I was diagnosed, I'm in the gym 5 days a week. I'm actually doing the 3 Peaks challenge next year, so climbing the 3 highest peaks in the UK in 24 hours.
I did that back at the end of the year.
Yeah.
I wouldn't do that again. No, I wouldn't do that again. But no, fair play. And we do find that a lot with certain demographics. When they get a diagnosis, they seem to do a bit of a life reset.
Reevaluating the way
that's the right word. Reevaluation of their lifestyle. And even though we do explain that in today's modern society, having a HIV diagnosis does not impede your life whatsoever, and it doesn't impede your lifespan.
Yeah.
You will live a normal, healthy life. And when you die, it will have nothing to do with HIV. No, sorry, to answer your question, it's hard to say. Yes, we do appreciate that 1 or 2 days won't do anything to your drug levels, but ideally, everybody would take them every single day.
Yeah.
That's the answer.
I take mine at 8:30 every night, and I'm
the next question.
Pretty strict on that as well.
So 8:30 p.m. So since we last saw you, have you missed any doses?
No. That's only happened, I think, once or twice, absolute maximum. And the last time that happened, I was working as a support worker in Norwich, drug and alcohol rehab, and I completely missed a dose. I went to go to my pill box and noticed that Wednesday's dose was still in there, and I thought, oh no, that's the first time it had happened.
So
I have double dosed before as well.
Yeah, I was going to say that. Yeah, you obviously know the rules about the dosing. Obviously, if you forget to take it at 8:30 and then you remember in the morning, if it's closer
to your next to the
dose, time that you've missed, just take it. But if you get to like, this time, it's probably worth just waiting until 8:30. If you woke up at 8 in the morning and realised you missed at 8:30,
I didn't realise until it was due to take my next medication the following day, so I just took it, and continued.
I mean, lots of our patients do who are on single tablet regimes, such as yourself. They buy these. We used to get them free from pharma companies, but we're not allowed to anymore. Pill key rings.
Yeah, I did have one of them. Yeah, so when I go out, it was a handy thing to have because it was an easier way of taking my medication instead of having to take a whole pot of pills out with me. I could just pop one in the key ring. That's what I used it for. But yeah, they don't do them anymore.
We're not allowed to accept,
unfortunately.
I mean,
it'd be a good thing if they could start again, because it's an awesome way for someone living who's with HIV to take their medication discreetly. If you're going out for dinner, I mean, I used to have to wrap it up in a piece of tissue paper.
Yeah, it's not ideal,
which obviously isn't great because it could get contaminated or whatever, I don't know. But
could fall out. We do, when we do start patients who are on multiple tablets, and then, the goal is, if possible, it's not for everybody, if we can get them on a single tablet regime, we then do say about these pill holders, and they'll be really good, and you can buy them for like less than £2 on Amazon.
Yeah.
And then they'll be a good thing to have, especially if people have, not regimented lifestyles. So those people we have do shift work. Those people we have are young.
Yeah.
So they can't commit to 8:30 p.m. because they don't know what they're going to be doing at 8:30 p.m. from day to day. So they are a great tool. So
it's just a time I picked out of the air when I got diagnosed. So it's just it's working well for me. It's not affecting my sleep. And Biktarvy, what I'm on at the moment, is the best I've been on so far. Triac was a nightmare.
Okay.
And I did explain to my previous specialist and Dr. Ibrahim that it was giving me insomnia and horrific dreams.
Okay.
And they said it's probably something you're doing and not the medication, but strangely enough, when I was taken off of it, all of that stopped. And they said as well, the reason for taking me off of it is it can contribute to heart disease. There is a small chance of that happening if there's a history of it in your family. So I just told them to take me off it after that.
The new guidance is that one drug you're on about, Bacavir. It's not.
The only complaint I would have with Biktarvy is I've gained quite a bit of weight since I've been put on it. That would, and I'm having to do a lot of fasting to control that. I mean, I'm 16 stone as we speak at the moment, and I did notice I probably gained about 10 pounds when I got on that, and it's all around the waist area, and I'm like super active, and I struggle to lose weight.
Sorry, I'm old school. I'm new school, sorry, I should say. 10 pounds to kgs.
And I have heard of other people, because I'm open about my diagnosis, people contact me online who themselves are on Biktarvy, living with HIV, and they said that when they went on that, they gained a massive amount of weight very rapidly and decided to come off of it, and the weight then dissipated.
It is a known, not a known, it is a recorded side effect from a proportion, I would say, of our patients who are taking Biktarvy. It's interesting that you've said it, because I think you're the first bloke who has told me.
Oh, okay.
Majority of the time it's females who tell me that they have weight gain, and there is a direct correlation between their switching to Biktarvy and they've not changed.
And it's all around the waist, it's not in other areas, you know. I'm carrying a little bit of muscle, you know, because I lift weights 5 days a week, but I'm finding it very, very difficult to lose any weight around the waist. I mean, I didn't eat for 48 hours once to try and just clear my system out. You know, I believe in fasting. I think there's a lot of benefits to it. Never lost an inch around my waist, nothing. It all fell off in other areas, and which is quite frustrating, you know.
I mean, obviously you do live a healthy lifestyle as well.
Yeah, don't get me wrong, I mean, I had fish and chips last night, so I'm not eating healthy every single day, but, you know, I'm active. I mean, I travel to the Peak District every Saturday, and I go hiking every Saturday without fail, and then 5 days a week I'm in the gym, so 6 days a week I'm pretty active. So,
okay, I mean, obviously it is a known side effect. It doesn't happen in all our patients. Let's say it happens in, I'd probably say less than 10%.
I mean, I don't know if there's any advice you could give me with regards to that. I mean, I don't want to come off Biktarvy because it's working well for me. And I don't want to go to a lesser medication that isn't as good.
Oh no, there's no lesser anymore. Remember, these are all approved by NHS England.
I know, but I was told that with Triamec, and then I was told it can contribute to heart disease after a year of being on it. So I wasn't very pleased about that.
Can't. It depends what your risk factors are for heart disease.
Yeah.
Those individuals who have a low risk factor, it's not felt to have any impact on the risk of further, you know, heart attacks or strokes or anything like that. Those who have high cardiovascular risk factors, then it's recommended to take them off, because it could not cause, and that's the difference, it could contribute to, but you'd already have to have a high risk factor for us then to think about the back of it to take you off it. So it's a contributing factor, not a causative factor at the back of it. With Biktarvy, no. As I say, it is something that a small proportion of our...
What about the injections? I've heard a lot of people that are having the injection now instead of the pills.
They are having the injections. So with the injections, it is 2 drugs. In each one has their own injection form. And then you have an injection into each buttock, one into one into the other. And you have that every 2 months.
Right, okay. That's the only downfall to it, I think, is you have to come in more regularly.
You do.
I would definitely consider that if it goes to every 6 months.
We would love for it to go.
Which I'm sure it will at some point.
Of course it will.
It's constantly evolving, isn't it? Treatment.
I feel that we are probably going to see that, hopefully, in the next. It's in the pharma company's power. It's not in our power. You know, I'm sure they've got something in the pipeline, and that they're doing, you know, work on. But I don't think we'll see that for the next couple of years, at least, maybe 2-3 years. But yeah, the only licensed NHS England injectable is every 2 months, and it has to be a strict criteria because of things such as cost. So you know, you would probably fall into the realm of acceptance, because obviously you're a great taker. You have a undetectable viral load of over a certain period of time. There's all these tick boxes.
I've never had a blip that I'm aware of, so that I'm aware of. I mean, it might have happened in between.
But one of the main things with the injections is, currently, as it stands with NHS England commissioning, is one of the things is if patients have difficulty taking oral medication. If you don't have that, you kind of fall out of it.
Yeah, I don't have any problem taking pills, you know.
I understand what you're saying about injections.
For many years of taking illegal pills, so yeah, party drugs. But yeah, I'm happy with Biktarvy. That was my only complaint, was just the weight side of things. I find it difficult to.
What we'll do is we will.
I mean, I've put on about 8 or 9 stone since my diagnosis. Now, a lot of that is lifting weights and things like that, and I think just the immune system recovering and functioning properly, and I'm eating better now. Whereas before I was eating once a day, you know, because my life revolved around getting high, but and my addiction. So I think that plays. There's a lot of factors that play into it. I think as well when you're talking about weight gain, but it's just something I've noticed. You know, some days I still only eat once a day. I'll go for a period of eating one good meal a day. I like to try different diets and what works for me. But yeah, normally I'll have just, I'll train in the morning. I won't eat until 12, 1 o'clock, and I'll have between 6 and 10 eggs when I eat, without bread. Like I say, egg is a multivitamin, so they're very good for you. And then I'll have an evening meal, and that's normally it. So I wouldn't say I'm eating huge amounts of food, and everything I'm eating is natural as well. So
yes, if there's no identifiable
my cholesterol is good as well.
Yeah, exactly.
The last check at the doctor's, it was in a very good place. No risk of diabetes at the moment, thank goodness.
No, see, it's not something we wouldn't routinely do your cholesterol unless there was something that we had to monitor. So no, we've not done it in the last set of bloods.
I think my first specialist checked it once, and it was 4.5 or something. He said.
So anything below 5 is good.
Yeah, so it was below 5. Yeah.
And then obviously we look at good fats and bad fats as well.
He said my good fats were 20% higher than the UK average, and my bad fats were 20% lower than the UK average. So excellent. I don't know what that means, but I'm assuming it's good.
It's clear that with the weight gain that you describe, yes, it could very well be linked to the Biktarvy. If there are no further, there is that link, further lifestyle modifications you make, what we can do today is document.
Yeah.
And then ultimately, it's something that we know happens with Biktarvy, and it would then be your decision. Do
you think it could be like water weight?
No, it doesn't work on things like renal function and stuff like that. So it couldn't be held water, as you call it, retained water. For patients who do report it, generally, if they find it's a personal preference at the end of the day, we know it can happen. And when it does happen, we have a drug that works very well. It's doing what it needs to be doing. However, it has to be taken in conjunction with patients' needs and wants. And if you're saying, I don't want to have this added factor of weight gain, which can happen with Biktarvy, then it's a joint decision that we make about, do we take you off Biktarvy then? That's the only option that we really have.
Yeah.
So it's a balance between the two. Obviously, what I would say is, so you would say
I think it's steady. My weight is always hovering between 15.5 and 16 stone. I did have a period where I went up to about 16.5. I think it was the heaviest. But then I cut out sugar for 6 weeks, and I lost like 8 pounds. Over those 6 weeks, I never had any sugar at all, not even fruit. And I lost half a stone straight away. So I'm managing it at the moment. It's not getting out of control.
I'll document that you've said it. It's obviously a direct correlation between when you started Biktarvy to this point, and we've got 10 pounds, 4.5 kg weight gain. I think when it comes to your next review in a further 6 months' time, if at that point it is increased, with you doing everything that you're doing at the moment, it's still gone up, then that is really a discussion to have with the consultant about. If you're happy continuing with Biktarvy, obviously it's something that you've noticed and you're aware of it. There are alternatives. There aren't lesser treatments. There are alternatives that we could potentially think about that would then eliminate that weight gain element.
Mm-hmm.
But I would say yes, Biktarvy
Okay.
is probably.
Another thing I wanted to ask as well is the kidneys. How are they looking?
Your kidneys should be
And my
absolutely fine.
CD4 count as well.
So yeah, your viral load is undetectable, so that's great. Your CD4 count. Oh, I need my glasses. 456. So anything above 400 is absolutely
so that's
fine.
dropped.
That's it. Right. So we've done a CD4 of 4.
I've never done
5,
above
6.
700, I don't think.
So that was done on the 23rd of October. Unfortunately, this system does not have a great cumulative feature built into it.
It's strange as well. I know people have got CD4s of 1,000 or more, and they're constantly getting sick. Mine's never been high, and I'm never sick. I can't work that one out.
There's no direct correlation between it. It's just how your body deals with it when you are sick. So having a high CD4 count doesn't make you immune to becoming ill. Not at all. That's why everybody gets colds and flu still. But it just means that if you did get in an actual kind of infection, then your body's better equipped to deal with that infection because you have more CD4 cells to help fight the infection.
Is it just natural? Some people have it. Mine's always been fairly low.
Of course, it's genetics. Some people have hovering CD4s. Everybody else lives their entire life not even knowing what CD4 means.
Exactly. Yeah.
And for all we know, they might have what we classify in theory as a low CD4, but they're fine.
Yeah.
And then people who have HIV diagnosis, we constantly look at their CD4s, and then it becomes a thing that everybody links with health. As long as it's...
I got obsessed with that when I first got diagnosed, trying to get that high, but...
Lots of people... and your body will only get it so high, and that's where it roughly stays. It doesn't incrementally keep going up the longer you're on.
I know someone who's been living with HIV for 12 years, and he lives in the States, and he was telling me that his always hovers around the 500 or 700 mark. He might have the odd occasion where it might spike to 800 or 900, but it tends to hover around the 500 all the time.
And if some of the clinicians here probably did their CD4 counts, we'd probably have lower CD4 counts than some of our patients.
Yeah. It's more important the detectable and undetectable part, isn't it?
Yeah. And as long as your CD4 count is in the healthy range, which is 400 and above, which yours is, and then obviously you are right, it has dropped. Your prior CD4 was done in May, was 631, so you've gone down from 631 to 456. So that's something I will note as well.
I mean, that could be down to even having a bug at the time or something like that. Could lower it, couldn't it?
It could do. If you had an infection actually at the time, that the one was done in May, your CD4 count might have been a bit high because your immune system's working to fight off a current infection, whereas this time it's not. It could be things like if you're a bit run down, whether that's through work stress,
gym probably,
too much,
can
also affect your immune
I think
system functions.
that is the case a lot of the times. I do go a bit too crazy at times in the gym. And I probably need to incorporate a few more rest days.
Let's see what the one before that was, so we can just get a general pattern. So that was the one done in May. The one prior to that was done in, obviously we've got the gap in the date, so that was done in June last year. 583, so that's in the middle of those two. Yeah. So
it tends to float around that sort of area.
You within the healthy region.
Yeah.
Obviously, it has dropped from May to October. We'll just keep an eye on it. It's still within the healthy level. If we see any further, hopefully the next time we do it, it will.
It had dropped. It dropped once to when I was diagnosed, about 330. It dropped one time. That was a long time ago, though.
Yeah.
Dr. Ibram didn't seem to be too concerned about it.
No, you have.
And lo and behold, the next 6 months later, I came in and it had gone right up to 500. And it was 600 and something, I think. And that's when she gave me a high. Well, I gave her a high five. I was over the moon with it because at that point,
I don't see Dr. Ibrahim initiating a high five. No. Fair play.
The kidneys are good.
So,
nothing to be concerned about.
Creatinine is marginally, and I mean very marginally, the range goes up to 104, yours is 110. That means very little, because we use that as a marker to work out your EGFR, which is an actual measurement of your kidney function.
Yeah.
Your EGFR is 69, anything above 60 is absolutely fine.
Okay.
So your creatinine was marginally higher, so linking into that, do you take any sports supplements?
No, she told me to stop taking them 2 years ago.
Okay.
Because I was taking protein powders, and I didn't realise there was a creatine supplement in there. I do try and eat a good amount of protein because obviously I'm trying to build muscle, so I don't know whether that could have anything to do with it. I don't know. I mean, I'm not taking any supplements, so.
And it could just be naturally, so it's just a marker of how much you've got in your body, and in theory, if it's within the range, that means your kidneys are flushing it out of the system.
Yeah.
If it's slightly higher, it just might be something to do with the day that you did it.
Yeah.
As I say, it's marginally.
I always get very, very, very nervous when I come in because I hate needles, which is unfortunate living with HIV. So my blood pressure is always high when they do my blood pressure.
I don't blame you, I hate needles.
It was crazy. It was off the scale last time I came in. I was that freaked out about it. I went home and used my dad's blood pressure machine, and it had gone down to 137/80.
Okay.
So that confirmed that it's like this white coat syndrome.
It's an actual thing, yeah.
So it's gone up to 100 and when I was in here it was 180 something over 112.
That's pretty high.
That's like.
And also one-off readings aren't that accurate. So what they do in.
We did 3 and the average was about 137 over 80.
The average is the best way of doing it, and we would actually say if you have concerns about your blood pressure, do a reading in the morning, reading in the evening, both times when you're chilled out.
Yeah.
Do it for a week. That is your 14 readings. Add up the bottom ones, add up the top ones, divide them by 14, and that's an actual true representation of your blood pressure as opposed to one-off, two-off readings. Just do it over a week. It's a better way of doing it. I say no, and also that creatinine might be slightly higher. You might have been slightly dehydrated.
Possibly,
when you came in.
I don't think I drink. I mean, I do drink water all day, but I don't think I drink enough of it. I have a couple of cups of coffee in the morning, that'll be it, and I drink water the rest of the day. But I know there's times where I am dehydrated without even realising. I think most of us are, but certainly training and being quite active, I need to drink more than the average person.
And it's fluids,
that's probably what it is. I mean, that might be what it is. I know I'm dehydrated quite often.
But I would say no. There's no issues with your kidneys to note whatsoever.
Brilliant.
What's this one? Profile. No, nothing there either. Okie dokie. So everything's absolutely fine. I will make a note regarding the weight gain, and I will make a note regarding the recent drop in CD4, and we'll just keep an eye on it. As I say, you're nowhere near anywhere that we would be concerned with your CD4 level. It's just something we'll keep an eye on. But as you say, you've had no recent illnesses or anything like that.
No, I get little bugs every now and then that I call them little niggles. You know,
probably
not like not like a full blown cold.
Yeah.
But you know there's something.
But it's not come out properly yet.
No, but it's not come out. So you're getting probably 20% of a full blown cold, if you know what I mean. And I have had something like that recently, where I haven't felt 100%. But you know, who knows? I mean, I'm still nearly 50 years old, and I'm doing what I'm doing, so I ain't doing too bad.
You've got a fair way off, mate. You know,
3.5 years. I'm not that far away.
Okay, so you said you've got one unopened left of Biktarvy, one unopened. So obviously Dr. Ibrahim likes everybody to have one unopened as a reserve for instances like what's just happened where you've had to cancel or we've had to move an appointment. It's always good to have that bulk in reserve. So what we'll do is we'll do a further 6 months because there's no reason why we can't, based on your bloods and based on what we've discussed today. I will aim to get that here for a week today.
Brilliant.
So that'll be here Wednesday the 3rd December.
Yeah.
It's going really quick. 3rd December, the clinic will obviously give you a call when it's arrived, and then just make your way down and click when you're next around this area.
Awesome.
You did say, apart from obviously the Biktarvy, you're not taking anything else?
No.
Nothing else?
Nothing.
Herbal?
I have herbal teas sometimes.
That's fine. So nothing that you regularly take from like Holland and Barrett or off the internet?
No, I don't take any. Last time I took vitamins, they made me feel worse. I got really lethargic. I took vitamin D for a while once, for about a week, and it made me, oh God, it felt awful.
That's the opposite effect of vitamin D.
Yeah, maybe it's because I'm I did speak to Dr. Ibrahim about this, and she said you might be overdosing on vitamins, which can have the opposite effect.
It can do. Vitamin D's one of those.
Because I eat a lot
ones
of
that's hard.
eggs, which have every vitamin and mineral in there that the world has to offer, apart from vitamin C. So if I'm eating between 5 and 10 eggs a day, I think I'm getting the vitamins that I need.
Vitamin D in eggs. Sorry, I'm not a dietitian. Let me check that.
Yeah. I think the only thing they don't have in is vitamin C.
Egg info.
Superfood is.
Egg.info.co.uk. Vitamin D has. They're doing this way. mcgs 1.6 mcgs. That doesn't help me. So that contributes to 63% of your recommended amount. There we go. So yes. So vitamin D, eggs, and sunshine is the two places you get your vitamin D from. So.
Eggs are, like I say, also the body absorbs more protein from an egg than it does from steak. So it's a better protein source than steak.
You don't work for the egg council or anything.
I don't know, but I should. But honestly, it is such a great food to eat. It is a superfood, and it is, I call it God's multivitamin. I mean,
it's not good on the go though, is it?
It is, if you boil them, boil them, and then take them with you in a little plastic lunchbox.
I suppose, but then you a
little bit of salt
in the tea room, or
they stink the place out.
I was going to say on a bus.
But they are super good for you. I mean, really, really great food to have. So I make sure I eat them pretty much every single day.
Good. Right, obviously I don't have any appointment cards here. I'll come out with you. So what we'll do then is we'll do the 6 month subscription, get that delivered here next week, and then obviously we'll do bloods again in 5.5 months and 2 weeks, and then we'll do your doctor's appointment ideally 2 weeks after that. In which case you still should have a month of tablets anyway, so that's absolutely fine. But yeah, as I say, we'll do the CD4 again obviously in 5 and a bit months, and we'll keep an eye on that. With the weight gain, just monitor it now.
Yep.
And then when you come back in 5.5 months, if it has gone up and it's still something that is on your mind, we can have a discussion about it then. And think about where you'd want to go. Do you want to stay on it? Do you want to try a change?
Yeah.
But we'll wait until that, because I think that being the only thing at the moment.
Everything else is good, and I don't really want to rock the boat. If I was starting to really, whack on the weight, then I would consider it. But it's just something I wanted to bring up.
And it's completely right.
I know there's many people that have spoken to me about gaining a lot of weight, but I know we have to take responsibility ourselves, because we can go through stages of eating a lot of crap. Which I did up until June, when I went up to almost 16 and a half stone. I thought I need to cut out. I'm going to try cutting out sugars here. I've cut it out and I lost half a stone in 6 weeks.
And unfortunately there's no such thing as the perfect antiretroviral. We're still trying for it, but everybody has their little things that they live with their antiretrovirals. As long as it's not a detriment to their health, we kind of get on with it.
I'm happy with another thing. Sorry if I'm keeping it. Are the injections, are they easier on your kidneys than the pills?
So your pill has no impact whatsoever on your kidneys.
Oh wow, I didn't know that.
It's a kidney-friendly regime.
Okay. That's something I get asked a lot as well. It must be hammering your kidneys and.
No, nothing hammers your kidneys. That's the misconception I think with the general public is if you.
This is all information from donkeys years ago that people are.
If you have a degree of renal failure. Now, failure is a harsh word, but that's how we use it. That's the term that we use. If you have a decreasing renal function, then some of our drugs which are explicitly renally cleared can accumulate. When they accumulate, then side effects and toxicity can happen. But those drugs aren't causing that initial drop in your renal function. Again, it's something's happened, our drugs build up, you feel worse or you have side effects, then we take you off those drugs. So you don't have those, but they're not causing the problem with your kidney in the first place. And unfortunately we are blokes, we are both approaching midlife,
Yeah.
our kidney function will decrease, and there's nothing
It's
we can
natural,
do
isn't
about
it?
it.
Everything is gonna
Everything's going to go down.
droop and.
And some of the drugs that we use, we do have to change with the aging population. But you are actually on a kidney-friendly regime, which we switch patients to
Okay.
when they start showing decreases in their renal function.
So a lot of these things are, a natural aging.
Yeah.
Yeah.
Nothing we can do about it.
No,
No
unfortunately.
matter how many hills you climb, or you go to the gym 8 days a week, it's not gonna.
Yeah.
It's not gonna change.
We try though.
But no, you are on a very, very kidney-friendly regime.
Brilliant.
And if your kidney function, for whatever reason, did drop below the 60 mark, which is what we would then monitor, we wouldn't have to change your tablet because it has no impact.
Okay. So, in your opinion, everything is looking good at the moment.
Everything clinically, everything's good.
Nothing to be concerned about.
No.
Brilliant.
As I say, the weight gain, keep an eye on it. It's a joint decision. If you want to carry on with that after 6 months, we will. If you want to discuss a change, we will understand that, because obviously it is a thing.
Yeah. Okay. Brilliant.
Cool.
Awesome.